Hello, today is Monday, March 18th, 2024. I had a rough time at work. I was chewed out by my senior managing director. Of course, the management is always worse. They just seem to get away with whatever they want to say. They shout at you, they just demand absurd things for you to act on, and I was chewed out because I made a mistake, but it was kind of a legitimate mistake. Nonetheless, I feel sorry for the day, but I need to practice English again by reading an English article each day, as with other days. So today's topic is headache that might result from jaw clenching or bruxism or teeth grinding. So I don't have a teeth grinding, but one time I had a really severe jaw clenching because I clenched my jaw teeth out of frustration about my life. That was 30 years ago when I was a senior in college. Ever since then, I had some problems with my head. So I'm going to read these articles to see if I get some insight as to how to address this problem, even though it has been a long since. So here we go. By the way, I'm trying to learn English or practice or honing on my English by reading an article each day. It stuck with me. This habit stuck with me ever since I finished my military service with the U.S. Army about 34 years ago. So it's a long habit. I'm very proud of it. By the way, I work for Korea Telecom KT, the number one carrier in Korea. But if you do have a nice job offer, like a job in California or in Florida, New York, Pennsylvania, Ohio, Chicago, Philadelphia, Colorado, Austin, Dallas, Houston, I don't care. I'm eager to consider your offer if the price is right. That's joking aside. Let's delve into this wonderful English article. I'm going to read it just like a native speaker does. Here we go. 13 treatments for clenching or grinding related headache. Posted by Dr. Paul Matthew, December 10th, 2017. Treatments, triggers, and causes. 529 shares. There's a lot. Video introduction. What is TMD, TMJ?
Well, first we have to start with the terminology.
How common is it, and why is it associated with a headache or migraine? And migraine. Associated, it has two pronunciations. Dr. Paul Matthew is a headache specialist and fellow of the American Headache Society. He is also an assistant professor of neurology at Harvard Medical School, where he serves as the director and founder of the Advanced Neurology Clerkship. Transcript. Click here to view video transcript. Teeth clenching occurs when the bottom and top teeth clamp together. Yes. Grinding occurs when the teeth move horizontally or back and forth while the teeth are clenched. Yep, one time I heard my brother, grinding his teeth while asleep. It's very loud and sometimes scary and also very pitiful. Bruxism is the medical name given to either clenching or grinding during the day or night. Okay, bruxism is for both. I thought bruxism is for grinding teeth, but it also includes clenching teeth, right? Teeth clenching. People who grind their teeth are 3 times more likely to experience headache, according to the Bruxism Association in the UK. So this guy, this Dr. Paul is from the UK. My daughter is going to Durham University come September. So I got suddenly interested in the UK. Most of the population will grind their teeth some point in their lifetime. Really. Clenching and grinding occur naturally when eating, but some people may also clench or grind involuntarily and excessively throughout the day and or night. Teeth are not designed to be in constant contact. They can briefly touch when you swallow or chew, but if they are in contact too often, it can wear down tooth enamel. Enamel is the outer part of the tooth which protects the inner structure. The risk of tooth decay increases without the protection of the enamel. How many people clench or grind excessively? Prevalence peaks in childhood and reaches its lowest rates in those over 65 years old. It is estimated that 8% of the adult population grind or clench their teeth at night. During the day, 20% of the general population report awareness of clenching their teeth. The same study also found that this was more common in females. Wow, that's scary, man. We always think that, we as men always think that women sleep well, beautifully, prettily, but they grind teeth and it gives you goosebumps, right? Bruxism tends to decrease with age. Symptoms of clenching or grinding, bruxism. Signs you may have bruxism include: it's easy to understand how the jaw might lead to headache and migraine when you to see how far reaching the jaw muscles stretch. What the I think there's something missing here. Signs you may have bruxism include, right? I think there's something missing here. But the score shows frontal, parietal, right? Parietal, I forgot. Temporalis, temporal, right? This is temporal, temporalis. It's easy to understand how the jaw might lead to headache and migraine when you see how far reaching the jaw muscles stretch. Something wrong. Headaches, earaches, migraine, sinus pain. Headache around the temples or even an earache can be a sign of excessive clenching or grinding, especially in the morning. In those with a history of migraine, bruxism episode can trigger a migraine attack. A bruxism episode. A bruxism episode. A bruxism episode. A bruxism episode. Right? A bruxism episode. A bruxism episode. Tender jaw or facial muscles or joints. So soreness, tenderness, and fatigue can be caused in the muscles and joints around the jaw and face. Stiff neck. Muscles around the jaw from clenching and grinding affect muscles in the surrounding areas, including the neck. A stiff neck may not be an obvious sign of clenching or grinding, but it is one to look out for, especially if other symptoms are present. Yeah, I have stiff neck. They say it's I shape letter one, like a straight stick, instead of curved as in C, right? The muscles in the jaw affect many other muscles around the head and neck. Dental wear, chipped, cracked, sensitive, and even loose teeth are not uncommon from the wear and tear that excessive clenching and grinding can cause. Extreme pressure can be exerted whilst clenching and grinding teeth, particularly at night when you are not consciously able to control the force of clenching or grinding. Teeth can also be worn down and shortened if left untreated. Man, I have problems with the upper and lower last teeth. I forgot the English names, but the last thick, flat teeth on both sides of your upper and lower teeth group. Enlarged jaw muscles. The act of clenching and grinding can be so strenuous over time that the patient may notice enlarged or overdeveloped jaw muscles. I never looked into that perspective, but I might have enlarged or overdeveloped jaw muscles. I have to check that out. I don't know how, but I have to. Enlarged jaw muscles, strenuous. Reduced oral function. In severe cases, bruxism can compromise basic oral functions such as chewing, speaking, and swallowing due to pain and tightness, limited opening of the mouth. Yep, I have a problem with chewing, or at least the swallowing. I constantly feel there's something bumpy in my throat. It never occurred when I was very young, when I was a college or high school student. But now, whenever I try to swallow yam, potato, or some large grained food, I feel something touches my throat, the bump in my throat, and it makes me to puke. I don't puke, but you feel like a vomiting, right? And also, you black out, right? In severe case, your partner tells you most people are not aware that they are clenching or grinding. It is often a bad partner who hears the grinding at night, or the dentist who can see the visible signs of enamel destruction due to excessive clenching or grinding. Bruxism is typically diagnosed by a dentist after a clinical evaluation. Other physicians who might diagnose bruxism are a maxillofacial surgeon, headache specialist, or sleep specialist. An overnight sleep study may also be warranted if there is suspicion that a sleep disorder is involved. If there is suspicion, right? Suspicion can be a noun sometimes, but generally is more abstract meaning concept or feeling or atmosphere, so that is not uncountable, right? So if there is suspicion, not if there is a suspicion, right? What's the difference between grinding TMJ and TMD? TMJ is an abbreviation for the temporal mandibular joint, which connects the jaw mandible to the skull. TMD is an abbreviation for temporal mandibular disorder. Almost same. Temporal mandibular joint, temporomandibular disorder. TMD is a broad term that often includes clenching and grinding. Even though there may be no problem with actual joint in cases of clenching and grinding, in severe and long-term cases, clenching or grinding may lead to joint damage. Temporal bone, mandible, right? This is mandible, lower jaw, mandible. Temporal bone, the temporomandibular joint, TMJ. The presence of popping and or clicking of the joint is suggestive of a physical problem with the joint. Mild cases involving popping and or clicking tend to resolve spontaneously, but moderate to severe cases may require physical or surgical intervention. How many people have TMD? TMD is quite common, but in the vast majority of cases, symptoms and clinical issues are mild. Only 4 to 7% of the population will have any symptoms of sufficient severity to warrant seeking medical advice. In the vast majority of cases, that's another good cliche, good expression, man. In the vast majority of cases, 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 what causes clenching or grinding at night whilst sleeping? There could be many different or multiple causes: intense concentration, stress, anger, anxiety, allergies, or blocked nose. Smoking. Yeah, I have a stuffy nose. Excessive alcohol or caffeine, illness, dehydration, sleep disorders, teeth misalignment, genetic factors, medications is a symptom of another condition. At night, whilst sleeping, there could be many different or multiple causes. Intense concentration. The American Academy of Oral Medicine suggests that concentration itself is sufficient to trigger bruxism. Yep, in the college, I concentrated a lot. I was smart, but most of the times not smart. I was very stubborn, S9, and also I concentrated well. 아재를 바이자 가자. Intense concentration. 크리스 글로 갔어. The American Academy of Oral Medicine suggests that concentration itself is sufficient to trigger bruxism. Stress, anger, or anxiety. Emotional stress is believed to be a common trigger for grinding or clenching teeth. This may lead to bruxism during the day and or at night. Stress, anger, anxiety. Anger, right? Anger. I was angry about myself. While I was a senior year in college. Allergies or blocked nose. Not being able to breathe through your nose due to allergies or being in a stuffy or dry room may contribute to more mouth breathing, which triggers the autonomic nerve system when sleeping. When this is switched on, muscle activity is under less of your voluntary control, and bruxism may be more likely to occur. Smoking. Bruxism is twice as common in smokers than non-smokers. Yeah, I'm a non-smoker, right? But I have a bruxism? Excessive alcohol or caffeine. These substances can reduce the quality of your sleep and trigger bruxism. Alcohol, caffeine. Yeah, I drink alcohol very moderately, like 1 can of beer each week or every 2 weeks or every 3 weeks. Caffeine, yeah, I drink 1 cup of coffee each day. during the weekdays, not the weekend. Illness. Physical illness and poor nutrition can be a contributor. Yeah, I have a loose stool. I lose a lot of nutrients through stool. Yeah, that could be one of the culprits. Dehydration. Insufficient fluids throughout the day may worsen bruxism. I drink a lot of water, especially in the summertime, but I think drinking a lot of water gives you dehydration and loose stool, diarrhea. Sleep disorders. Sleep bruxism is considered a type of sleep disorder. It can also be associated with other sleep disorders such as sleep apnea and snoring. Sleep apnea means you just skip breathing, right? Your intake of oxygen is very low. You skip like 2 or 3 breaths. When the body approaches deep sleep, muscles are required to fully relax. This can cause problems in some cases to maintain fully patient airways. That is, there is an open path between the lungs and outside air. When the body approaches deep sleep, muscles are required to fully relax. This can cause problems in some cases to maintain fully patent airways. Patent, right? IP, intellectual patent. Patent way airways. That is an open path between the lungs and the outside air. For example, the tongue, when fully relaxed, expands significantly. Another potential airway impediment is the relaxed jaw. According to Dr. Mark Burhan, researchers discovered those with a partial package in their airways could grind or clench to reopen the airway in their sleep. Once the patients were able to keep their airways open all night, the grinding stopped. Interesting. I gotta be careful, right? I have stuffy nose and maybe I have sleep apnea for 10 seconds and maybe it just makes me grind my teeth and peeling off the animal. That's bullshit, man. Self-destruction. Airway obstruction could be a root cause of sleep bruxism. A sleep study might be warranted for sleep patients. If you have sleep apnea, a night guard could be making both the sleep apnea and bruxism worse. What is a night guard? Guard at night, right? A night guard could be making both the sleep apnea and bruxism worse. Teeth misalignment. A poor bite or malocclusion has historically been thought to play a role in bruxism, but a number of studies have failed to demonstrate the link. That said, poorly designed filings that sit too high may also contribute to grinding. Poorly designed filings, right? Genetic factors. If family members clench or grind, then you are more prone to develop the habit as well. Medications. Bruxism can be a side effect of some medications. That's bullshit. That's terrible, man. I mean, you take medications, but you develop bruxism because of that. The most common types of medications listing bruxism as a potential side effect are the second generation antidepressants, including SSRIs and SNRIs, and antipsychotics. That's bullshit. All psychological things. And it's a symptom of another condition. In some instances, bruxism has been associated with other neurological disorders, drug-resistant temporal lobe epilepsy, dystonia, Alzheimer's, stroke, traumatic brain injury, and Huntington's disease have associations with bruxism. These factors can also play a role in bruxism during the day. Daytime bruxism is often seen as a habit in response to stress and anxiety. How to treat clenching and grinding? Studies have acknowledged that treating daytime bruxism is challenging due to increased levels of anxiety and somatic symptoms reported in these patients. Somatic symptoms refer to psychological distress of some kind expressing itself as physical symptoms in the body. So it has both connection between psychological things, psychology, and the bodily functions, right? Somatic symptoms refer to psychological distress of some kind expressing itself as physical symptoms in the body. Despite the absence of physical cause, somatic symptoms such as pain, nausea, and clenching are real and not falsely purported. Most people will experience somatic symptoms at some point. For example, a nervous public speaker may feel nauseous and even vomit from the fear of speaking in front of a large audience. Few high-quality studies have been conducted to evaluate treatments directed at clenching or grinding during the day. Without evidence-based treatments for daytime bruxism, only general suggestions can be made cautiously, which are listed below. There have been several randomized control trials evaluating the treatment of sleep bruxism. Evidence supporting the treatments is mentioned where available. 1. Good sleep hygiene. 2. Mouth guard. Yeah, maybe mouth guard is a night guard too, right? 3. Mandibular advancement devices. 4. Stress management. 5. Regular exercise. 6. Behavioral therapy. 7. Botox. 8. Electrical stimulation. 9. Hypnosis. 10. Physical therapy. 11. Meditation. 12. Medications. Supplements. Magnesium, vitamin C. Yeah, I'll stop here and come back to here. Right? It's a long story. So I'm going to continue to read this article for you tomorrow morning. So it's a 2-day reading. But I will just stop and upload my reading for the day, because I don't think you will be listening to my reading continuously.